All right, we will start the webinar. Maria, please start the sessions when you are ready. Thank you.
Good afternoon, good morning, everyone.
Good afternoon, good morning.
Hello, Chichoncho. Hello, Dr. Milliam Chichoncho. Hello, everyone.
Hello,
Welcome to this
Maria.
webinar.
Thank you.
Very nice to see you. We were supposed to start with introducing the webinar through our program manager, Anna Sanatusamake, who's having some connectivity issue at the moment. So
Okay.
not to further delay the webinar, Anna, are you online with us? I think she's having a connectivity issue. We can maybe start in the interest of time. So, as Global Alliance on Health and Pollution, we're very pleased today to host Dr. Chichoncho Milliam, one of our gender equity, social inclusion expert in Uganda, and walking through the process of trying to incorporate Gedsi elements in pollution control policy in Uganda, and what was the path and what that meant. And of course, this is something very critical for an organization like the Global Alliance on Health and Pollution, because not only we have specific policies in place to ensure that we look at those components, but we consistently try to incorporate gender equity, disability, and social inclusion in our programs and in the way we operate. Because as we know, 9 million deaths are caused every year by pollution, and the numbers affect a lot women, children, and people living with disability more than many other ones because of the condition they live in. So this is an effort that we should try to do all the time. I also want to thank our finder, which is the UK International Development, the ODA Hub, through the DEFRA, the Department of Environment, Food and Rural Affairs of the UK, and all the people who have been involved in the program in Uganda. So today we're going to listen to our expert specifically on this topic, but this is included in activities that are going on in Uganda through the environmental pollution program. So I see that there are some house rules before we go into the presentation. And so I'll ask the participant to keep your microphone muted. Then you can raise questions through the chat. And then I'll give the space to Chichonjo. You can now start.
Okay. Are the introductions done? I thought so. So we are leaving the preliminaries.
Anna is not joining us. I can do the preliminary if you
I
want.
thought somebody wanted to take over. Anna, I don't know.
Yes, please.
Yes.
Yes.
So do you want to first do some of those introductions and preliminary?
Yes, Emily, can you go back to the slide that interview
definitely.
about agriculture policies review? Yes, please. Oh, yeah, this one. Thank you.
Okay. Right.
Yeah, so Dr. Kichonko, can you please do a preliminary introduction about the purpose of the webinar today? Thank you.
Okay. Thank you all. Thank you, the participants. Yeah. So today we have a webinar on incorporating gender, equality, disability, and social inclusion. Thank you for inviting me to be the presenter. But before that, yeah, as Maria has said, this has been, it's not new. It's part of the EPP project, which has been going on in Uganda. And it included, in the project, we conducted a desk review of Uganda's waste management and agricultural policies and In this, we intended to include to show how these policies can address or impact poverty, gender equality, and social inclusion and health. We also tried to identify the gaps where women, youth, and marginalized communities are disproportionately affected. So this was part of the project, and which I participated in together with my colleague, Dr. Elizabeth Katsime. Next slide, thank you. Yeah, so for those who don't know me, I'm Dr. Kichonche Miriam. I'm a lecturer at Chambogo University, Uganda. I've been there for the last 20 years. I lecture sociology, but also I'm a senior research fellow with Action Coalition for Climate Change. My expertise is in gender equality, agriculture and human rights, and climate change. I hold a PhD in social and behavioral social sciences from the City University of Hong Kong and an MPhil in environment studies from the University of Cambridge. So I'm happy to present to you how GEDIS can be incorporated in pollution control in Uganda. Thank you. Next slide. Okay, so my presentation is divided into 3 parts. Why pollution is a GEDIS issue, why we should incorporate it, and how should we incorporate it. Maybe before we go to our first slide, for those who are not conversant with the terms, gender, gender can be looked at as the social construction of the relationship between men and women. Gender shapes access to resources, access to responsibilities, access to power, access to decision-making. It affects health, education, employment, and participation in all aspects of life. So it matters a lot. We all know disability. So when we talk about social inclusion, what are we trying to do? We are trying to remove the barriers that prevent participation of all people in social, political, and economic life, and ensuring that the interventions are equitable and that resources and rights and opportunities are accessed to all. So GEDIS, gender equality and social inclusion, can be seen as a policy, a research, a development approach that tries or aspires to ensure that the projects and interventions are equitable and inclusive. And so in all aspects of life, including pollution. And that's why we are here, to look at pollution as a gender issue. So that's a background, maybe a short background about Uganda, for those who don't know Uganda. Uganda is an agricultural-based economy. Almost 70% of the labor force in Uganda is employed in agriculture. According to statistics, it contributes to up to 24% of the domestic product, the GDP product, gross domestic product. However, the sector is faced by different challenges. For example, currently, climate change, pollution, environmental degradation, poor management practices. But those problems that I've talked about are more pronounced for the vulnerable. Also to note that this economy is based on smallholder farming practices, mostly women and other vulnerable people, and who depend on rain. It is rain-fed economy and traditional subsistence practices. So with these problems of environmental degradation, climate change, the vulnerable are more affected, especially the women who contribute up to 70% of the labor force, and who are responsible for household chores, who are responsible for collecting firewood, who are responsible for collecting the water. So that is the gender division of labor. So how is pollution a gender issue? With that background, it is a gender issue because it affects people differently. Men, women, children, elderly are affected differently. So you can see on our first slide that in Uganda, in particular, and Africa in general, women are responsible for cooking. And since they are responsible for cooking, they are more exposed to smoke from biomass fuels. It should be noted that in Uganda, we use a lot of biomass. In the countryside, most people cook using firewood. In the city in Kampala where I stay, even in my home, I have charcoal. We use charcoal. So since women are responsible for the cooking, they are more exposed to smoke from the biomass. Next slide, thank you. So gender roles and outdoor pollution. I've already talked about how agriculture employs majority of the women. Some statistics actually show 70 to 80% being employed in agriculture. So what does that mean? They are more exposed to chemicals and other types of pollution. Then women and informal waste workers, most of them lack protective equipment. In Uganda, there's poor plastic disposal. If you come to Kampala and outskirts, you're going to see. So since women and other vulnerable communities are exposed to those working environments, they are more disproportionately affected as compared to men and people who are not excluded. Thank you. Another slide. So we talk about disability and pollution vulnerability. So people with disabilities, for example, physical disability, already have their pre-existing health conditions. So they are more vulnerable to pollution because of those existing conditions. So that's why pollution is a gender issue. They also have limited mobility, which increases their exposure, especially if they are living near polluted environment. Then we talk about accessibility barriers and pollution vulnerability. If you come to our country, pollution control infrastructures, most of them lack universal design. Look at public toilets. If you go to Kampala, you're going to find a toilet in the third floor of the building, and you wonder how a person with physical disability can access. And when you look at the entrance of some of those infrastructures, they don't consider person seated in the wheelchair. When you look at drainage channels, when you look at garbage disposals, most of them are in place, and they assume that all of us are able to move to those places. And then environmental health information, even when it's available, it may not be accessible to persons with visual impairments. So that's why pollution is a JEDS issue. Next slide, thank you. So look at poverty, informal work, and social exclusion. The poor and excluded groups, especially women, people with disabilities, tend to live and work in polluted environments. So this increases the exposure to waste, chemical, air pollution, and other types of pollution. Gender, pregnancy, and outdoor pollution, exposure to ambient pollution, air pollution, increases the risk of preterm birth, low birth weight, and other related health issues. Then pregnant women are biologically more vulnerable to pollution exposure. And then I've already talked about the gender roles. So water pollution and its associated problems affect more women who are responsible for collecting water, so they are exposed to waterborne diseases and chemical contaminants. Next slide, thank you. Okay, so the rural communities and environmental degradation. So today we are facing a lot of environmental degradation, so the soil and water pollution, and this affects agricultural productivity, which, of course, directly affects women who form majority of smallholder farmers in our country. So the people with disabilities, again, that they have barriers in adapting to degraded environments. With all those aspects, we cannot say that Uganda has not done anything. So we come to institution and policy gaps, but before that, we need to know that there are policies that are in place. There is Climate Change Act of 2021. It tries to address pollution and greenhouse emissions. We have the Constitution of Uganda. It stipulates rights of all to clean, healthy, and sanitation. We have the National Environment Act of 2019. We have the National Environment Waste Management Regulations of 2020. So there are many policies in place. So, and most of them actually recognize the vulnerable. The policies recognize women as key stakeholders in resource management. They recognize the impact of pollution on different categories of people, but there are gaps. For example, most of these policies I've talked about, they don't clearly state expressively the integration of JDs. Most of them actually, they ignore people with disabilities. Most of them, you cannot see the gender and disability data related to pollution. And this, of course, weakens the policy. Most of them lack enforcement. And in most of them, women and other excluded groups have limited participation in the environmental decision making. So that's the policy gap. That's why now JEDIS is an issue in pollution control in Uganda. Thank you. Our next slide. So with that, why should we incorporate JEDIS in pollution control? Why should it matter? Why do we need it? Our next slide. Thank you. So we need it because when we incorporate gender equality, disability, and social inclusion, we protect public health. I've already talked about the impact of pollution. So we help to protect the pregnant women, the future generation, which strengthens public health outcomes. We already talked about the impact. Then, of course, ensuring accountability. We've already talked about the policies. So if we incorporate it, it ensures that pollution and pollution control infrastructure, communication, and emergency responses are accessible to all. And this ensures accountability from the government. Then addressing poverty and social exclusion. If we have JEDIS focused policies, it ensures that pollution control efforts can reach those who are affected, especially women, children, the youth, and all those who stay in informal settlements and are exposed to pollution. Then, of course, it assures that policy effectiveness and sustainability. If we have JEDIS integrated, it will improve uptake of clean technologies, community ownership, and long-term sustainability of environmental interventions. Thank you. Our next slide. Why do we need JEDIS incorporated in pollution control? Okay. So when we do this, we strengthen participation and accountability. So inclusivity leads to a more responsive pollution control strategies, which strengthens accountability both at the national and local levels. And also, of course, aligning with national and global development goals. Today, we are talking about sustainable development goals. Uganda is party to it. So when we include JEDs in pollution control, it supports Uganda's commitment under the Constitution, under the national development plans, under the climate change and international frameworks such as the Sustainable Development Goals. And of course, also it advances environmental justice. We already know that women and other marginalized groups are already vulnerable. So when we include JEDs in pollution control, we ensure that they are not further marginalized. Instead, they are protected. It also improves policy effectiveness. I've already talked about it. Next slide. Okay, so we began with pollution as a JEDIS issue. Why should we incorporate it? Now, how should we incorporate it? With that background, our next slide, please. Thank you. I've already talked about the existing policies. So we should start with enforcement of the existing policies on pollution and the gender policy enforcements. So how do we do this? Integrate JEDIS compliance into routine. We can have environmental incorporation, strengthening environmental, gender, and local government, institutional priorities, protection. And who can do this? I said it can't be done by one agency, NEMA, National Environmental Management Authority, Ministry of Water and Environment, Environmental Protection Police Unit, local governments. So all of these should work together. The civil society, Ministry of Gender, Labor and Social Development should work together, combined at least to ensure that the existing policies are enforced. Then mainstream gender in pollution and in pollution control policies and guidelines. The existing policies, some of them actually are outdated. We can review, we can revise them, and incorporate aspects that protect women and other vulnerable communities from pollution. And who can help us in this? Still, NEMA can be at the forefront, the Minister of Gender, Labor and Social Development, the Parliamentary Committee on Environment and Gender, and other relevant actors. Then promote inclusive participation and pollution in decision making. For example, we can have minimum quota because we already said that women and other vulnerable communities, they lack participation. So we can have that inclusivity by having, for example, minimum quotas, community consultations, participation for inclusion, and other aspects. Then mainstreaming, I've already talked about it, monitoring and evaluation. Of course, it's very important. Of course, if you don't monitor, ensure compliance, or to ensure that the outcome is achieved, you may not achieve what you intend to achieve. So can we have the JEDIS sensitive indicators and community feedback? Who is affected? What percentage is affected? And many other indicators can be very important in helping us incorporate gender, equality and disability inclusion. Next slide. Okay, so I've already talked about how women and other marginalized communities are exposed especially when they work in informal settlements. They lack protective gears. So can we protect them? Can we protect people with disabilities and informal workers, especially in high exposure areas? So there are those hotspots, especially Kampala and the outskirts of Kampala, for those who come from Uganda, the Katanga, Bwaisi, and other places. So provide protective equipment, formally recognize and regulate informal waste workers. And this can be a coordinated effort done by KCCA, that is Kampala Capital City Authority, Minister of Local Governments, private waste management companies, NGOs, CBOs working with urban livelihoods. Then we can strengthen JED's responsive data monitoring. So we need to do collect data and disaggregate it by age, by disability, to see who is more exposed. And this can help us to have targeted interventions and to also ensure enforcement in monitoring frameworks. We also need to build capacity of institutions and frontline staff, especially the environmental officers, the inspectors, and local leaders on JEDs and pollution-related issues. Next slide. Thank you. So what else can we do? Sometimes enforcement is affected by budget. No, the will is there, but the budget is not there. Maybe we try with consciousness, sometimes we are not even conscious of the impact. So there's need for allocation of gender responsive and inclusive budget for pollution control at national and local levels. Also, awareness creation. Some of us don't know the impact of using, for example, biomass in cooking, even when we can avoid it. We don't know the impact of the cooking gadgets that we use. So the awareness creation, we don't know the impact of improper waste disposal. We can do something within our means. So awareness creation, strengthen collaborations and partnership. That is also very important. The government, non-government organizations, and other CBOs, like the GAHAPU approach, that can help us to incorporate JEDs in pollution control in Uganda. And in this, we should target pollution hotspots in informal settlements, prioritize informal settlements for waste collection, drainage improvement, and air quality management, but also promote community-based waste segregation and recycling with women and people with disabilities groups as implementers. So that can be a good bottom-up approach that can help us to incorporate gender, disability, and social inclusion in pollution control in Uganda. So thank you for listening to me. So I think the next slides have these references and yeah.
Thank you, Dr. Chichoncho, for this wonderful presentation. And I think it was very insightful for me and everyone here to listen to this discussion about the role of women in agriculture in Uganda, and also how gender equality, disability, and social inclusion can be incorporated into national policies, national action plans, and how this should be done strategically in a way that inclusion actually means inclusion, in the way that the policy protects them, and also the budget allocated for enforcement implementation also reflects this position. So my name is Hassanatu Anasamaki. I am the program manager for the Global Alliance on Health and Pollution. And you've heard this wonderful discussion about gender equality, disability, and social inclusion. This webinar is a result of the Environmental Pollution Program that we started in June 2025. This program had several objectives, which included the review of Uganda's waste management and agricultural policies, with special attention to gender equality, disability, social inclusion, poverty, and pollution, because we wanted to look at these policies and to see how inclusive they are in the implementation, in the intention, and also in the enforcement. We also developed a health and pollution action plan through national and local stakeholders, including the National Environment Management Authority, the Ministry of Health, Ministry of Environment, Ministry of Gender, Ministry of Agriculture. So all of the stakeholders who have a mandate in pollution control and management in Uganda. And then we had a civil society-led awareness campaign on the same issues, which are diverse pollution issues, including air pollution, water pollution, improper waste management, contaminated sites, heavy metals, and others. As part of this program, we had several other initiatives, such as working with the Birmingham and Makerere University in Uganda to work on a traffic-related air pollution, as part of which GAP successfully purchased 38 air quality sensors to boost the air quality monitoring network in Uganda. And we wanted to wrap this up by doing an economic study of pollution impact, because the whole program, which is the Environmental Pollution Program, funded by the UK government through the Department for Environment, Food and Rural Affairs, was to look at the pollution agenda, prioritize which pollutions have the most impact on health. And this program was implemented by the Global Alliance on Health and Pollution in partnership with national ministries, private sector, civil society organization, and NGOs. So this Gedsi is an issue that I'm sure is being discussed in all of your employment places, even at GAP, as we use equal employment opportunities to ensure that when we recruit, when we retain, when we have programs, when we design programs in the various countries that we work in, that gender equality, disability, and social inclusion is at the forefront, whether it's about attendance to the various events, whether it's about the whole design of the project, whether it's about the direct beneficiaries. These are things that we do to ensure that when we work somewhere, we want to advance on these issues as well. So thank you all. I know this is the Q&A section now. I do not see any questions in the chat. Does anyone want to ask their question now? We only have a few minutes before the end of the webinar. So the house rules, please keep your microphone muted during the Q&A unless you are speaking. And you can drop the questions in the chat, and also you can raise your hand so that we may unmute you for any questions that you may have. There is a question. You have been reviewing agricultural policies in Uganda. How are Gedsi considerations integrated into these policies, and what key lessons can be drawn from this integration in practice? Dr. Chichancho, this is a question for you. You are muted.
Oh, I'm sorry. I didn't know I was muted. I didn't know I was muted. Thank you for the question. Yes, through EPP program, I participated in the reviewing of the draft, the policy or draft policy on agriculture and waste management policies. Specifically, I worked on agricultural policies. I reviewed around 14 policies: the national agricultural policy, national seed policy, national fisheries aquaculture policy, national organic policy. Yeah, these policies, for example, the national agricultural policy, it acknowledges that women are vulnerable, that they are key players in agriculture economy, and that they should be protected. And according to, for example, the National Agriculture Policy, the implementation, it proposes the implementation strategy in the National Agriculture Implementation Framework. However, the policy is of 2016, and it has not been reviewed since then. So most of the policies actually acknowledge, talk about women, youth especially, how they should be incorporated, but they lack implementation strategies. Today, at least there is what we call the parish development model, which is an agricultural framework, which is implemented at the parish levels. For it, at least it has tried to incorporate, to include the vulnerable, because it has the committees, and those committees have women, have youth, have people with disabilities. Policies are there in place. Gedsi considerations are there, especially when it comes to women and youth. Some of them are silent when it comes to people with disabilities, apart from the parish development model, which is being implemented through the Ministry of Agriculture. Something is being done. And with the effort that of us, GAHAP, and the other civil society organizations, we hope to see more changes, especially when it comes to practice. Policy is there, but practice is a bit lacking.
Okay.
And
Thank you, Doctor.
Yeah.
Sorry. Yes, you may go ahead.
Okay, I was talking about also enforcement, which is also a problem, and also this in the like lack of coordination, especially the Minister of Health Affairs alone, the Minister of Water and Environment is for Minister of Gender. So there is this the segregated, there's uncoordinated effort which is going on. But of course, as I've said, with these efforts that we are having, we hope to see more Gedsi commitments from the government.
Thank you, Dr. Chichoncho. We have a couple of questions. I see a hand up, but let me make a comment. We are glad to hear that there are initiatives being taken into account. And there was a question here. Is the environmental pollution program embedding Gedsi approaches in other countries or initiatives? The answer is yes. The environmental pollution program has been ongoing in Vietnam since 2022. This program is also led by GAP, and we have worked successfully with farmers, communities, schools, businesses to integrate best practices and to promote integrated pest management in the country. The EPP Vietnam has reached quite a significant number of people in the past 3 years. And recently we did a regional pollution forum where we brought in key stakeholders from Southeast Asia to discuss pollution issues. And gender equality and disability was also at the forefront of this discussion. There is another question in the chat. How can community-based organizations strengthen inclusive participation in environmental governance? This is a question for Dr. Chichoncho.
Yes,
Um,
and sorry, Anna, this is a question from myself. And actually, I like to ask the question and comment because, as you mentioned in the beginning, Anna, we involved and collaborated with civil society organization to ensure that across the environmental pollution program and the health and pollution action plan, we could involve communities. And so that those messages, data, and approaches will be done and taken into consideration directly in the communities. And to make this possible, we engage with them and we also set up some indicators. And of course, we saw difference in between one civil society organization and another in different districts. So my question for Dr. Chichoncho and yourself, and I think also for anyone else who is in this webinar, because I see some people from Uganda are joining us, will be how can we further support community-based organization to encourage inclusive participation? Because, we noticed that those vary and very different, and so, in your opinion, what else should be we're looking at or doing to make them more effective? Thank you.
I can begin if there's any other person can contribute. If you look at most of the environmental message portrayed on radios and TVs and televisions, most of it is in English. Maybe the community-based organizations can help translate the policy into local languages. How can it be done? They can run community dialogues, they can have drama, they can have skills, they can have radio shows in local languages. And that can also help to make sure that at least the message can reach a wider community, because we have, not everybody is educated here in our country, unlike other countries. So I think they can also increase maybe citizen science, train youth, have women groups to monitor air quality, to monitor pollution, or illegal dumping. So that community ownership or community participation in environmental management can help.
Thank you, Dr. Chichoncho. And I would like to highlight that we implemented this from the design phase of the program. Dr. Chichoncho here present actually drafted a guide to help us during the recruitment and selection of civil society organizations to ensure that they are meeting this gender equality and disability principles before we even selected them. And she was also instrumental in helping us to lead a training where we work with the civil society organizations that were a part of the program, about 4, which includes the Youth Advocacy Development Network, Hands of Hope Initiative, Equal Lives Foundation, and Anti-Climate Inclusion, to strengthen their capacity in effective advocacy in the communities, and also how the messages can be inclusive, so that when they invite everyone from the various communities they work in, that they are intentionally inviting and being inclusive of everyone. This is in the selection of the venue. This is in the selection of the messages that are being portrayed, because we realize that pollution impacts the vulnerable communities, which includes women, children, and the elderly, and we specifically targeted them in some of the activities that we are done. So thank you, Dr. Chichoncho, for your contribution in that work. We have another question from Dr. Emmanuel Tebadeke. Yes, Dr. Emmanuel.
Thank you very much, Dr. Chichoncho, for your presentation.
Thank you.
Can you hear me?
Yes, I can hear you.
Mine it comes in as a comment, and also goes to response partly to what Maria raised. In your presentation, there is where you hinted about where pregnant women are biologically more exposed to pollution exposure. And then your hint was more on the health impacts. But actually, when you look at many developing countries like Uganda, when you look at the issues of Uganda and pregnant women in particular, there are some biological angles that actually make them more prone to exposure. For example, we know that we have pregnant mothers in villages who eat soil, and they eat soil
True.
because of the low iron that they have in
Yeah,
their
true.
body. And so once the soil is contaminated, these are of course going to be exposed to pollution. We have pregnant mothers who use herbal preparations made out of clay, and this
Yeah,
clay
true.
is highly loaded with heavy metals from industrial processes, thereby exposing mothers to pollution. We have pregnant mothers working with their children in artisanal gold mining, thereby exposing themselves and their fetus to toxic metals. We have pregnant mothers working in agriculture and they're exposed to these pesticides. So the issue when it comes to capacity building for CSOs, capacity building for communities, issues of or community awareness and education campaigns, it's still a big campaign that has to be done in Uganda because the rules of exposure are actually very many. And we should have targeted messages that target a specific group of people. Like when you tailor a message for pregnant mothers, they actually have to see that there are specific routes of exposure that are only for them, like eating soil, like using those herbal preparations. A study done by Pure Earth when they surveyed the Mumba preparations. If they had very few samples, but they all tested positive of lead. So this tells you that actually we still have issues that we need to
True.
deal with. Thank you very much.
Yeah, thank you for that insight for contribution. There's a lot actually when it comes. Nearby, there is a stone quarry where I stay. And recently, I had not moved there. So I was going up and I found very many women actually hitting stones and with the children. And they didn't have any protective gear. So you're right. There's a lot when it comes to exposure for pregnant women and women in general. Thank you for that contribution, Dr. Emma.
Thank you, Dr. Emmanuel. Dr. Emmanuel is the national coordinator for the GAP projects in Uganda, and he has helped with implement the EPP. And before that, he also led the working group on lead, and so that's what explained his contribution from earlier. So thank you. Do we have another questions? The question, how can we better demonstrate the value and results of advocacy work to donors and partners, given that behavioral and policy change are often long-term and difficult to measure directly?
What's the question?
Let me repeat the question.
Oh,
How
it's
can
for
we
Dr.
better
Emmanuel. Actually, it's for Dr. Emma.
for Dr. Emmanuel, how can
Yeah.
we better demonstrate the value and results of advocacy work to donors and partners, given that behavioral and policy changes are often long-term and difficult to measure directly?
At the onset of these campaigns, we can usually engage baseline and end-line surveys to actually see the knowledge that the communities have about certain topics. For example, for the campaigns that where we have led, you could enter community and then you see they're not knowledgeable that actually we did a campaign on lead, that the saucepan that we're using to cook their food could actually expose them to lead pollution. But at the end of the campaign, when you go back to do an end-line survey, you could see that majority of the household where the campaign was being held had an idea that actually those saucepans were poisoning their food, and many were trying to transfer from those saucepans to other types of saucepans. So these surveys can actually give us an idea of how knowledgeable the communities are. So the baseline and inline surveys, if these are packaged within the program implementation, they can give us an idea of how far the community has benefited from our advocacy campaigns. Thank you.
Thank you, Dr. Emmanuel. Dr. Chichoncho, I have a question for you. Being in this line work for the past 20 to 25 years, and I'm sure that you've seen a lot of things on gender equality and disability, social inclusion. So can you tell us a moment where you feel that this gender equality, there is been some advancement on this in the country or on agricultural policies, if you wanted to be more specific?
You mean the advancement, like in terms of policy, in terms of implementation?
In terms of enforcement, in terms of progress overall?
In terms of progress overall, yeah, with the when you look at the policies, though I have said that most of them are outdated, that most of them need to be reviewed, the practice, yeah, with today, I've talked about the parish development model. Women are being recognized. The women groups, not only in the cities, but also in the countryside. There are women groups who are receiving actual money from the government to support them to have access to inputs, agricultural inputs. There is also a lot of awareness campaigns from the civil society organizations. The government itself, there is affirmative action, not only in education, but also in representation. When you have political representation, it's easier now to tackle the problems at the grassroots level. So there is improvement. There's a lot going on. And of course, with our effort now, I can see a lot with the civil societies that we engaged. We hope for the best. With the research that we are doing, with the engagement of KCCA, with our conferences that we held with the different stakeholders, I expect more greater change in terms of GEDS incorporation.
Thank you, Dr. Chichoncho. Do we have any last questions before the end of the webinar? Okay, so if no more questions, I would like to thank everyone for attending this webinar and for helping in preparing. Our communication team was essential in making this happen. So thank you, Kevin and Emily. Thank you, Sophia, for helping on this, Dr. Chichoncho for being our speaker, Dr. Emmanuel, Maria Paula, Leah. So thank everyone. I would like to thank everyone from the GAP team. So now I would like to invite Maria Paula to say any final words before we end this webinar.
Thank you, and I just would like to thank Dr. Chichoncho, yourself, Emmanuel, and all the participants of this that attended this webinar. That was very informative, but it's just a symbolic testimonies of what we have been doing in Uganda and what we will try to bring across countries and programs. So I think I want to close with a statement and an ask to everyone to keep on challenging your partners, your donors, people you work with, to try to be as inclusive as we can while understanding the local context. So that, of course, it's so fundamental to work with locals. And I think that has happened in Uganda, even though we are an international alliance, but we have strong partners, strong local partners in Uganda, and it has been a beautiful journey. And I hope we will continue to go that path. So thanks to everyone that made this webinar possible, but also to each and every partner that work with us in Uganda and ensure that gender equity and social inclusion was part of our programs consistently.
Thank you, Maria Paula, and thank you everyone for attending, and have a great afternoon. Thank you.